Hello, I'm Dr. Ed Heidelberger, Vice President of Medical Affairs here at the Bertrand Chaffee Hospital, bringing you another coronavirus update. We know it's been almost about a week since our last update, but a lot has happened. And I'm here today with Dr. Tracy Fabin, our newest physician in the Primary Care Center.
Hi everybody, I'm Dr. Fabin. I'm one of the new providers here at Bertrand Chaffee Primary Center. I work with our other providers in the Family Medicine Center. We just want to say how excited we are to be part of the Springville community, and me personally, I'm really excited to be part of this practice. We're working really hard to keep all our patients safe and healthy. As part of our job, we want to try to keep you out of the hospital as much as possible. So in doing that, we just want to emphasize how important it is to try and get your COVID vaccine as soon as possible. We know with the holidays coming up, everybody wants to spend time with their families and friends, and we are very supportive of that. We just want to make sure that everybody stays as safe as possible. And the number one thing you can do is to get vaccinated.
First of all, I'd like to give you an update of where we stand today. In Erie County, there are now 284 people hospitalized with coronavirus. Remember when we last talked, about a month ago, that number was only about 120. So we've doubled the amount of people in the hospitals. Many of you have seen what that entails as you go to the emergency room and find you have to wait longer and longer to get seen. Typically now in Erie County, 8 to 12 hours in wait in an emergency room is typical. These increases in hospitalization and illness have occurred due to a combination of factors. The low rate of vaccination in some of our communities, the Delta variant, and unfortunately, the waning effect of our COVID vaccines as well. These three factors have resulted in an increase in hospitalization and coronavirus in our communities. One of the most important things we measure is how many people are positive on a test. Well, when we last talked to you, in Erie County, that rate was about 5% of people tested are positive. It is now 10%. Cattaraugus County is in the 12%, has remained in that area. Wyoming County is in 10 to 15%. And overall in New York State, which was at 2%, is now up to 5%. Our hospitals are near capacity and the waiting times in the emergency room are going up. We want to ask ourselves, what is going on with our COVID patients? Well, it's very interesting. About 2 months ago when we talked about this, about 90% of the hospitalized patients were patients who had never had the COVID vaccine, and 10% were people who had breakthrough infections. Now, that number has changed a bit, and 60% of the people in the hospitals have not had the vaccine, and 37 to 40% of the patients in the hospital have had vaccinations. Again, this is reflecting the waning of the vaccination effect of the antibodies. Important question you might ask is, are the vaccines effective? When we start talking about breakthrough infections, people have the idea that the vaccines are not effective. Nothing could be further from the truth. If we look at the entire state of New York, there have been 151,000 cases of breakthrough infections. This is only 1.2% of the total population vaccinated. It is a very small number. Vaccines have been shown to be safe and effective in reducing the incidence of coronavirus across our nation repeatedly. Again, right now we're seeing that the vaccine antibody levels are waning, and we recommend people get a booster vaccination. Other things you can do to keep yourself safe during this holiday season is to mask yourself when you're in the community and out in public because of the breakthrough infections and the waning vaccination status. Erie County has just released a mandate for vaccinated and unvaccinated patients to have the mask in public, any indoor public area. Furthermore, social distancing remains effective, as does good hand washing. An important point I'd like to talk to you today about is quarantine. There are different recommendations and guidelines that have been coming out over the last couple of months that have left people a little bit confused on what we mean. First of all, if you have coronavirus, you've been diagnosed with a positive antibody test or an antigen test, and you have coronavirus, you must remain quarantined. That means isolated in your home away from others. That quarantine will last until you're not infectious, which is typically about 10 days. And then that quarantine can end. However, if you're now a close contact to somebody, which is defined as being within 6 feet of somebody with coronavirus, if you have a mask or even if you don't have a mask, and it's more than 15 minutes within a 24-hour period, you're defined as a close contact. If you are a close contact, you have to quarantine for 10 days from that date of contact. However, Erie County has just came out with a new regulation that says you can shorten that period of quarantine to 7 days if after 5 days you have a negative coronavirus test. People who are vaccinated, who are fully vaccinated and have close contact and have no symptoms, do not need to isolate themselves. However, the CDC, because of the increased prevalence in our community, has recommended this past week that people who are vaccinated and exposed after 5 to 7 days get a repeat coronavirus test just to make sure that they are no longer infectious or potentially infectious. Finally, if you had coronavirus, you are considered protected for 90 days after your coronavirus incident. Those people who have had coronavirus are under the same guidelines as those who have been vaccinated. And if they're asymptomatic, they do not need to quarantine. While we've seen the cases in our community increase, our hospitalizations increase, and the amount of contacts and people we know coming down to coronavirus, including those who have had the vaccine, increase, one wonders, is this going to be a difficult period of time? And the answer is, it may be. We have a lot of community gatherings and a lot of family gatherings that occur during the holiday seasons, and we want to keep everybody safe and protected. The best way to do this is make sure number one, your immunizations are up to date. If you had coronavirus immunizations, either Pfizer or Moderna, and it's been more than 6 months, you need to get yourself a booster vaccination. This will keep your antibody levels high and give you the greatest amount of protection against contracting the coronavirus. Number two, remember to keep safe distancing and wear your mask when you're out in public. This is important both in Erie County, where it's now mandated, as well as the surrounding communities where there's no mandate. However, the incidence of coronavirus is still very high in the community. That includes Cattaraugus and Wyoming counties. We should wear our masks when in public indoor areas. And finally, number three, maintain social distance and remember to wash your hands when going out and touching things in the community. On behalf of the Bertrand Chaffee Hospital, we wish you and your family a very safe, healthy, and happy holiday season.